Hi, this is Dr. A, and we're going to continue our review of Chapter 14, which is our review and analysis of the U.S. healthcare system based on the 5th edition of Basics of the U.S. Healthcare System. Okay, so let's continue with population health. The concept of population health has continued to evolve over the years. There are different viewpoints of what the concept of population health is and its impact on the healthcare industry. The CDC, which is the Center for Disease Control and Prevention, it views population health as an interdisciplinary approach to health that allows local health departments to develop community partnerships to achieve successful health outcomes. Population health provides pathways to address problems that drive poor health in a designated population. So again, the idea of population health, we could, target a certain population. So, for example, the issue of maternal mortality and infant mortality, that's a population health issue within a state, and the population that is the target are the pregnant women, and that is the population's health we're trying to improve. Due to the increased need for mental health care across the population as a result of the pandemic, there have been calls that the population health approach may be beneficial to behavioral health because it can apply any intervention across several populations. So this is an idea that we are playing with, and I think it has merit. So this approach of linking population health to primary care is what we call patient-centered accountable delivery models through performance measures by the clinicians. So again, primary care is the front line. This is where we have access to our patients the most, and so linking population health in primary care only makes sense. Examples of the type of care received, so primary care and population health merged, include team-based care, coaching to develop healthy skills, and disease registries that focus on the population health component. Programs that are targeted to a specific population and use different interventions to improve health outcomes are part of population health. Population health managers put individuals at the core of their care plan. So the idea is, even though we're talking about population health in improving the health of a group of people, it is still a one-on-one thing, especially if you merge it with primary care. The idea is health improvements begin with the care of the individual, and as each individual gets healthier, then the health of the population then improves. You can create treatment plans for patients to avoid trips to the emergency room, and it provides the opportunity then to reduce healthcare costs. Organizing patients into population segments provide opportunities for primary and secondary prevention activities, and again, to be able to target those populations. Pop health provides a foundation to reduce health crises by reducing hospital visits, medication needs, and medical visits, which then should, of course, decrease also the healthcare cost. Population health expects the patient to be engaged in their health outcomes, which then results in patient empowerment and better outcomes. So let's recap inpatient and outpatient services. So in 2019, 21 hospitals closed across the United States. The pandemic had a profound impact on hospital finances. When the deadly disease hit in 2020, hospitals were reeling from the influx of patients. Medical care professionals, particularly nurses, left in droves. There was massive burnout, and a lot of them left and just went into careers that were not even healthcare related. I have a friend that was a nurse that she left, and she is happily working at Krispy Kreme currently. Hospitals had to hire travel nurses, which cost over 200% more than nurses. Labor costs were increasing, but typically profitable services such as elective surgeries were stopped in hospitals because there were no clinicians to perform these surgeries, and it was reckless to introduce patients to a very contagious environment when it was not necessary. And so this kind of like perfect storm happened, and it really had a huge impact on these hospitals and on staffing and on healthcare in general. So in addition to the pandemic impact, as a result of the increased competition of outpatient services, because they are more cost-effective, efficient, and consumer-friendly, and because of reduced reimbursement from Medicare and Medicaid, many hospitals have developed strategies to increase their financial stability, such as purchasing outpatient facilities. And you'll see even in rural access hospitals, they're changing their models of care and things. So as a side note, my husband works in a rural hospital, and one of the things that they've done to make it profitable is to have a geriatric psych unit, and they have an adult psych unit, and they did that by, they closed their ICU, and they only have an ER, and they fly out any kind of critical patients. So they have just a general med-surg floor, and then have these psych units, and they're actually talking about closing labor and delivery now, and maybe potentially turning that into an adult psych unit. And those, they turn patients there, it's keeping the hospital profitable and open. So let's talk about long-term care. According to the Department of Health and Human Services, long-term care services include a broad range of health, personal care, and supportive services that meet the needs of older people and other adults whose capacity for self-care is limited. So most long-term care is not medical care, but rather assistance with basic personal tasks of everyday life. It could be getting washed, getting dressed, sometimes eating or cooking, things like that. So long-term care is often provided by family and friends. According to a 2022 report, a U.S. adult who reaches 65 years of age should expect to live approximately 20 more years. So again, 65 is typical retirement age, so you should have enough in retirement to provide for yourself for 20 more years. But you may also require long-term care services, either in a facility or some community-based services, with 1 in 5 individuals needing services for more than 5 years. The average length of stay in a nursing home or need for long-term care tends to be around 3 years, but the average cost can be close to $100,000 a year. So, it's something you have to think about and plan for, because the longer you live, the longer you may need those services, and you'll need money to pay for it. And the problem is that most people have not financially planned for their long-term care needs. The healthcare labor force. So the health industry is one of the largest employers in the United States and employs more than 14% of the U.S. workforce. Because of the aging of our population, the Bureau of Labor Statistics indicates that the health industry will generate nearly 2.6 million new jobs by 2030. The pandemic has created a shortage of labor because of burnout. Two 2022 Deloitte survey of health systems executive and clinicians indicated that massive burnout is seen, resulting in labor shortages, and recommended that there needs to be a redesign of the healthcare system, including how jobs need to be redesigned to motivate and retain employees. Examples includes automating some of these administrative requirements or tasking them to other employees to give clinicians more time with their patients. Let's talk healthcare spending. Government spending in healthcare increased 36%, so more than a third in 2020, compared to the average of a 5.9 to 6% increase. And so that was 5.9 in 2019, but it usually does not increase by 36%. And so that was, of course, the highest percentage of spending since 2002. The total healthcare spending in 2020 was 19.7% of the GDP due to the pandemic. And the increased federal spending was a result of federal initiatives, aiming at keeping the hospitals open and supplied. And of course, there was this massive influx of patients into the hospitals. So, there is a lot of justification for that. Since then, our percent of the GDP spent on healthcare has dropped to in the 18% range. So it's better, but it's still the highest in the world. The reason the U.S. Healthcare costs are so expensive is because of the price of medical care, such as our use of technology and our high labor costs. So we have some of the most well-paid doctors and healthcare staff in the world also, and that does drive the price of healthcare up, and we do use technology a lot. In 2020, 91.4% of the U.S. population was covered by public or private health insurance. The major public health insurance programs consist of Medicare, Medicaid, TRICARE, which is the military, and the Children's Health Insurance Program, also known as CHIP. So these are all government funded, in one way or another. So this is why they're public health insurance programs. So again, Medicare is for the elderly, Medicaid are for those in financial need, TRICARE is for the military, and the CHIP is for children that whose parents or the families make too much to qualify for Medicaid but don't have health insurance. The Affordable Care Act collaborated with private health insurance companies to establish a health marketplace which provides affordable plans for individuals and increased access to healthcare plans. Private health insurance are provided by companies, and typically have a contract with an employer, and so they can offer a group health insurance to the employees. So companies like Blue Cross Blue Shield, for example, or Aetna, large employers like hospitals and large manufacturing companies, etc., and then they offer that to their employees. So the bulk of health coverage in the U.S., so like more than 60%, is the private health insurance that is obtained through your employer. Some larger companies offer their own health insurance plans to their employees, which means they are self-insured, they collect the premiums, put it in a pool, and use that pool of money to pay for their services, but they usually are managed through a health insurance company. Many insurance plans require their enrollees to contribute to the health insurance costs by either paying monthly premiums, which are usually taken from a paycheck, or they have an annual deductible. A lot of times they have an annual deductible, and they also may have some co-pays, etc. These out-of-pocket payments are a way to defray some of the employer cost. These high costs are something that drives decisions of companies whether or not they want to settle in the U.S. Because it is expensive to pay for healthcare here. Information technology. It impacts every aspect of the healthcare industry. Information technology has had tremendous impact on the healthcare industry because it allows faster documentation of every transaction, and also these transactions can be audited. When an industry focuses on saving lives, it is important that every activity has a written document that describes the activity. Or as we said it in the lab, if you didn't document it, you didn't do it. So you have to document everything that you do or it didn't happen, right? Computerization of the documentation has increased the management, efficiency, and accuracy of all this healthcare data. Telemedicine has become more advanced and cost efficient, increasing access to healthcare services. So now we're going to go to healthcare law and ethics. It is important to understand basic legal principles that influence the healthcare work environment, including the legal relationship between the healthcare provider and the patients, but also all the employment laws, etc. Ethical standards are considered one level above a legal action because individuals make a choice based on what is the right thing to do, not what is required by law. And there are many interpretations of the concepts of ethics. It has been interpreted as the moral foundation for standards of conduct, which are vital in healthcare. A lot of the standards of conduct or codes of conduct are put out by specific professions. And there are, guidelines of standards of care and things like that that needs to be known if you're practicing your profession. And you should definitely be aware of all the different potential legal and ethical issues that you may run into in healthcare as a consumer or as a provider. And lastly, mental health. So mental health disabilities reduce the life expectancy of individuals by several years. The treatment of mental health disorders has been traditionally underfunded because of the attitude of the traditional healthcare system and this dichotomy, the separation of physical health versus mental health. They should all be health, should all be together. So the Mental Health Parity and Addiction Equity Act of 2008 and its 2013 final rules further support mental health care by requiring insurance plans to offer benefits and cost-sharing provisions for those mental health treatment that are similar to those for traditional medical care. So trying to make mental health care just like regular health care. So, all right, so that wraps up our review of the U.S. healthcare system. We have some more in this chapter, so we're going to look at trends and new trends in the U.S. healthcare system in the next